Hello and welcome. Today we're diving into a condition that affects the urinary system, specifically the urethral erosion. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Let's get started. So, what exactly causes urethral erosion? The causes can vary, but some common culprits include chronic inflammation or irritation of the urethra. This might arise from long-term catheter use, recurrent urinary tract infections, or even certain sexually transmitted infections. Surgical interventions, particularly those involving the urethra or surrounding tissues, can sometimes lead to erosion as well. In rare cases, tumors or other growths can also contribute to this condition. Ultimately, anything that weakens or damages the urethral lining can increase the risk of erosion. To understand urethral erosion, we need to look at the pathophysiology. Essentially, the protective lining of the urethra, the mucosa, begins to break down. This breakdown can extend deeper into the urethral wall. Prolonged irritation or pressure leads to cellular damage. The body's natural repair mechanisms may be overwhelmed or impaired, preventing proper healing and leading to the formation of an ulcer or a weakened area in the urethra. This weakened area is then susceptible to further damage, perpetuating the erosive process and potentially leading to complications such as stricture formation or fistulas. Unfortunately, precise epidemiological data on urethral erosion is limited. It's often underreported or misdiagnosed, making it challenging to determine its true prevalence in the general population. However, it's generally understood that individuals with long-term catheterization, those with a history of recurrent UTIs or STIs, and patients who have undergone urethral surgeries are at a higher risk of developing this condition. Specific groups, such as elderly patients requiring long-term care or individuals with underlying medical conditions affecting tissue healing, may also exhibit a greater predisposition. The signs and symptoms of urethral erosion can vary depending on the severity and location of the erosion. Common symptoms include pain or discomfort during urination, also known as dysuria. Patients may experience a weak or spraying urine stream. Blood in the urine, or hematuria, can also be present. Some individuals might notice a discharge from the urethra. In more severe cases, urethral strictures can form, leading to urinary retention or difficulty emptying the bladder. It's important to note that these symptoms can overlap with other urinary conditions, so proper diagnosis is crucial. Diagnosing urethral erosion typically involves a thorough medical history and physical examination. The doctor will ask about your symptoms, medical history, and any relevant risk factors. A urinalysis can help detect infection or blood in the urine. Imaging studies, such as a retrograde urethrogram, where a contrast dye is injected into the urethra and X-rays are taken, can visualize the urethra and identify any areas of erosion or stricture. Cystoscopy, a procedure where a small camera is inserted into the urethra, allows direct visualization of the urethral lining and can aid in confirming the diagnosis and assessing the extent of the erosion. While there aren't formally classified two types of urethral erosion in the same way you might classify cancers, we can describe it based on severity or location. Severity can range from superficial erosions affecting only the mucosal layer to deeper erosions extending into the muscular layer or even beyond. Location is also important. Erosion can occur anywhere along the urethra, from the meatus, the opening, to the bladder neck. The specific location and severity will influence treatment strategies. Treatment and management of urethral erosion depend on the underlying cause and the severity of the condition. Conservative measures, such as antibiotics to treat infections, may be sufficient for mild cases. For more severe erosions or those complicated by strictures, surgical intervention may be necessary. Surgical options include urethral dilation to widen the urethra, urethrotomy to cut the stricture, or urethroplasty, which involves reconstructing the urethra with tissue grafts or flaps. Long-term catheterization should be avoided if possible, or managed carefully to minimize further irritation. Pain management is also an important aspect of treatment. Preventing urethral erosion involves addressing the underlying risk factors, minimizing prolonged catheter use, promptly treating urinary tract infections and sexually transmitted infections, and careful surgical technique during urethral procedures can all help reduce the risk. Good hygiene practices and avoiding irritants to the urethra can also be beneficial. For individuals at high risk, such as those requiring long-term catheterization, regular monitoring and proactive management can help detect and address early signs of erosion. The prognosis for urethral erosion varies depending on the severity of the condition, the underlying cause, and the effectiveness of treatment. Early diagnosis and appropriate management can often lead to successful outcomes and prevent long-term complications. However, Recurrent erosions or those complicated by strictures may require more extensive treatment and have a less favorable prognosis. Ongoing research is focused on developing new and improved techniques for urethral reconstruction, as well as strategies to prevent urethral damage from catheterization and other risk factors. Further research is also exploring the potential of regenerative medicine approaches to promote urethral tissue healing and repair.